So I'm here with Arthur, who had a basal cell that was biopsy proven from the right nasal alar fold, and we gave him the option, right, to do Mohs surgery or to do laser.
Yes.
And opted for the laser. So how was your overall experience with the laser?
I thought it was excellent. I thought there was some discomfort at first, but that vanished fairly quickly. And consequently, I followed what Dr. Robinson had laid out for me, and I felt fine. I just followed all the instructions, and from what I understand about Mohs and other types of surgery, this is much simpler and the results are excellent. So more than that, I really cannot say. At this point, I'm very pleased, and I'm glad I went along with the program.
I really appreciate it, Arthur. Hopefully we'll help a lot more people. The procedure was fairly quick, 5-10 minutes?
The procedure was very quick, and it was in and out, and it was done perfectly fine, as it was explained prior to my going in for the procedure. Followed it exactly, and again, it was as explained. Follow all the instructions in terms of cleaning, in terms of putting on salve, which worked well. There was a little bit of throbbing at first, okay, but no pain, just a throb. I took my Tylenol, and that resolved it very, very quickly. I slept fine, and it was in a unique spot, as you can probably tell. So consequently, I just had to be a little careful blowing my nose, and you know, it's a wintertime cold, etc. So you do get a lot of, of the congestion, and it was no problem. I just followed all the instructions, and it turned out at this point just fine. And Dr. Robinson is a man of his word.
No, thank you. Could we take a closer look, Arthur, just where it was here? And there was no sutures involved, correct?
Correct.
So this was the area right here, and as you can see, there's really nothing there that looks ominous. There's a little bit of background redness that will fade over time. And you mentioned you had a friend who had Mohs surgery.
Yes.
Did that play a role in you choosing the laser?
It did. She went in for Mohs surgery. It was explained, and she's a very smart, articulate lady, and her experience, from what I understand at least, has been less than optimal. She's had to go back numerous times and had numerous, I don't know what you call it.
Revisions on the surgical site?
Yes,
Okay.
thank you. Revisions on the surgical site, and going back and forth and back and forth. And not only does it occupy her time, but of course it occupies the surgeon's time. And as I understand what we went with the laser, it was quick, it was simple. Hopefully the results are going to be excellent. I expect that they will be. And it's just a much simpler, expedited way to do something that really should be considered, and that's why I really recommend it for others.
And the cosmetic results now, it's been a month out, are pretty good.
The results so far have been excellent. The cosmetics are excellent. There's a little redness, of course, around the site, which I understand is typical and normal. And it's been just as explained. It's been exactly that. I put a little cream on afterwards. I tried to lubricate the site. I followed the instructions for cleaning both morning and evening, and it's been fine. The fact is, at sometimes I even forgot I had it, which I guess is good.
It's good, Arthur. I'm just curious too. The Academy of Dermatology, and being a board certified dermatologist, we always try to promote prevention. We kind of think it as prevention as opposed to just treating when things happen.
Yes.
So going forward, we did talk a little bit about sun protection. Going forward, what would you tell people to try to do to protect themselves from possibly getting skin cancer down the road?
Well, let me just preface this by saying I had been a big violator of not putting on any skin protection. My skin is a little darker. I'm not that fair, so I always either forgot or just didn't do it. At this point in time in my life, I would say to do it. I would say to look at your clothing, make sure you have the UPF protection, which, as we know, many pieces of clothing come with. I would say to be, the word I would use is probably vigilant. I'd be vigilant about skin and skin cancer because, frankly, previously I had not even thought about it. I had never had an issue. This is the first time I've been in to see the doctor, and it's really an education for me.
So we also talked about maybe like a brim with a 4-inch hat.
Right. I had always been an advocate for baseball caps. I know my grandson is a Mets fan, so I try to be religious about that. But now the 4-inch cap, like I guess the various manufacturers make it, makes a lot of sense to me. And just, I would emphasize, as you get older, you've got to be wary and careful, because not everything, and not only skin I found, but in other areas, you just have to be cognizant of what happens as you get older. And many of us, myself included, are not. And so we have to learn.
It's great. So, an SPF of 30 or greater, and like you were brilliant. You came in for your regular skin check at least.
Yeah.
And, as we spoke, you didn't know this was there until we said, well, maybe we should ought to check this.
I hadn't been in for a skin check in a while. And I told myself, and my wife had mentioned this as well, I'm going to see Dr. Bruce and this and that. I said, I think I'm due, and I was probably overdue, frankly. And I went in, and thank God I went in. It was found, it was taken care of. I was due, and that goes back to getting older and realizing things that you may not have realized before when you were younger, or just didn't want to realize them, as I didn't want to. And was taken care of, and I must say I sleep better. and it's and I'm being as candid as I can be.
Well, I really appreciate it, Arthur, and hopefully we continue helping patients sort of really get the treatment that they need, quick, expeditious, no sutures, no downtime, being able to resume their normal activities.
Yes.
With great cosmetic results. I appreciate so much sharing it with other people and being so candid.
I think that you deserve to be acknowledged and recognized. Okay, if I'm an example, and I can't say enough about it, okay, it was simple, straightforward, and really, I almost at times forgot that I had the procedure done. It was so painless and thorough.
Appreciate it, Arthur. Thank you so much.
Sure.
Really, that's going to go a long